Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today I've got a great exercise for your sacroiliac joint pain while pregnant. It's one of my favorites that I've taught my patients over the last 30 years, and I hope it helps you too. Now there are a lot of mechanical and postural changes that occur in the body while pregnant. We're going to address two of the main ones, or two of the most common ones, with this particular exercise. As we advance in our pregnancy and our weight increases and as our baby grows, we have a tendency to compensate or react to that increased weight in the front of us by leaning our hips forward. That's a passive way of trying to use ligaments and not muscles to help support that weight by bringing the entire pelvic brim underneath. And we usually then have to compensate for that by having our rib cage move backwards and our head move forward. And this is what we commonly call sway back posture, where the hips are more forward, the head is more forward, and the rib cage is back. And that disturbs the normal line of posture that should be vertically between our ear, shoulder, hip, and knee. The other thing that happens is as we come forward, the tailbone many times raises up higher than the pubic bone, because as the weight descends and pulls our pelvis forward, our abdominal muscles start to weaken and lengthen, the low back muscles start to tighten, the buttock muscles start to weaken, and that's also associated with an external rotation of our hips, meaning the legs start to turn out or the feet start to flare out, usually one side more than another. So we're going to address all of these common postural issues with one exercise. Now remember, any corrective exercise is going to be much more beneficial for you if it's customized for your unique body. In this case, what we're going to be looking for is which particular leg has a tendency to turn out more than another. We'll all have one side slightly more asymmetrical. Typically, that's been a habit long before we even became pregnant, where we like to cross that leg over or turn that leg out. So if you haven't yet done so, look at your feet standing, go for a little walk, and try to notice which leg seems to turn out more than another. Typically, that's going to be the one that you're going to start your walk with, or cross over the other leg at your ankle or at your knee. We're going to use that as we use this corrective exercise against, in this instance, the back of a chair, but at home you could use this on a kitchen countertop or the back of a sofa or even a wall. You're going to stand about 2 to 3 feet away from the surface you're going to hold on to. It doesn't matter the height as long as it's not too low. You want it at least hand height, if you put your hands down that height, or maybe within 12 inches above that. You want to position your feet so that both of your heels are going to turn out in a pigeon-toed stance. The leg that has a tendency to turn out more, you want to pigeon-toe that in a little further, and you want to have that leg move backwards about an inch behind the front of the other leg. So one foot is slightly back compared to the other, both heels are out. Again, only move the leg back as far as is comfortable and turn the hips in or the feet in as far as is comfortable. We'll then correct our sway back posture by bringing our hips backwards, and as we bring our hips straight back, let's keep our tailbone tucked under. Normally when the tailbone tucks under, the pubic bone is going to rotate upwards, so you have a whole rotation or rock of your pelvis. That's using your abdominal muscles to pull your pubic bone upwards, and that's stretching the often tight lower back muscles that connect into that sacrum and that ilium, affecting the sacroiliac joint. You're going to squeeze your buttocks together. Now typically the buttock on the side of the leg that turns out more is going to be weaker, so you need a little bit more focus on trying to tense or squeeze that buttock compared to the other one. If you're having trouble contracting the buttocks, tense the tailbone under just a little bit more with a little more tension, and that will allow the low back muscles to relax so you can grab the buttock muscles a little more. We'll then hold that position as we pull our heads back and try to move our chest straight forward. So that's correcting the typical forward hip, forward head, and backwards rib. We're bringing everything in the opposite direction. Head and hips back with tail under, and chest slightly forward. And then we're just going to lean on our counter surface. Again, we're going to keep the buttocks tight, the tail under, and that position of the feet being pigeon-toed with one leg slightly behind, and we're going to hold that position. Gravity in this case wants the lower back to arch, wants our abdomen to bend forward more, but by keeping the tummy in and the tail under, And the head back, we're going to be engaging those abdominal muscles, those gluteal muscles, relaxing the tight back muscles, helping to assist that postural correction, which is going to reduce the stress on our sacroiliac joints. As you're holding that position, make sure you're breathing with the upper tummy moving in and out. Remember I said tummy in, specifically that's the lower tummy. We're thinking of just pulling in slightly, not a lot, just a little tension in. That's under our belly button. The upper tummy is going to breathe using our diaphragm as we're holding that position. We don't want to hold our breath and increase our blood pressure. Simply want to make sure that the core muscles are being tensed. I would suggest starting that for a 5 or 10 second hold. You can do between 3 and 8 repetitions at the beginning. I do this every other day. It's a strengthening exercise, not a stretch. So you want to try to increase the time by a few seconds or the number of reps by 1 or 2 every other day when you do this. You can eventually build up to 2 to 3 minutes of a hold. The more that you do this and you get further into your pregnancy, you're going to be helping to unlock that typical postural abnormal tendency to have the pelvis move forward, to have the head move forward, to be stressing the sacroiliac joints, and you're going to help to reorganize and balance the muscular forces across your hips, which is going to help to relieve a lot of that sacroiliac pain. Again, there are other supportive exercises that help you get into this position that are also good for your lower back and hips. You can find those on the Pain Free and Fit website and any of our products. If you like this video, give us a thumbs up. Help us to help more women out there with sacroiliac pain. If you have any questions or comments, please leave them below. I'll do my best to get back to you. I hope this simple exercise helps with your sacroiliac pain.